Hi everyone, welcome to the instructional video of the Adult IV Arm Task Trainer. So before starting the procedure, we will learn how to set a base for the whole setup. So as you can see that we have got a rod and we have got a screw inside the rod. Along with that, we have got a hook and a base. First of all, we have to unscrew the screw and take it out the screw from the base, and then you have to fix the rod onto the screw and rotate in a direction so that it fixes to the base. Place the hook at the top of the rod. Our setup is ready. How to prepare the simulated blood. We have a simulated blood powder. I have taken 250 milliliters of water, add few drops of a simulated blood powder. And this will help you to prepare the simulated blood. We will fill the prepared simulated blood into the feeding bags. Lock the feeding bag so that it doesn't spill. To set the connections for the IV arm, take the end of the feeding bag and connect to the latex tubings coming out from the IV adult arm, and then fix it like this by opening the clamp. We will allow the air to pass out from the another tubing. As you can see that we have fluid going out to the tubings, which will also allow the air bubbles to pass out. Connect the nozzle of the another enteral bag into this tubing, and again open the clamp to have a running blood circulation into the IV adult arm. How to insert the IV cannula into the IV adult arm. To insert the IV cannula, well, take the cannula and insert it at 10-degree angle into the vein. So this was all about the 4th Adult Arm Task Trainer. If you have any queries, you can write it down in the comment section. Thank you.